Hi, my name's Jennie Burch and I work in St Mark's Hospital in UK.
Hi there, my name's Angie Balfour and I'm the lead ERAS nurse in Edinburgh, Scotland.
We're going to briefly explore patient education and its importance in relation to enhanced recovery. Angie, thinking about enhanced recovery and preoperative education, for many years we've already been explaining surgical procedures to patients before their operation. I wonder if you could give us some other examples of when patient information might be required before surgery.
Well, I think some of the key issues is we need to tell the patients how they can help themselves prepare for their operation. If we think about not only the physical effects of surgery, there's also psychological effects that we should discuss with patients, such as setting realistic expectations of their operation to reduce some of the anxiety. We need to listen to any concerns that the patients or relatives might have about their operation. How long will they be in hospital? How will they manage when they get home? Things like that. But we also need to encourage patients to take some ownership of their own recovery by asking them to prepare or train for it, actually. Similar to athletes preparing for a marathon, they would not arrive at the starting line without having prepared first. That would be crazy. They would have increased their exercise, they would have modified their diet and would focus on the end result, which would be completing the marathon, ideally at a quick pace. Same concept here, except the marathon is surgery and the end result is to have a better, safer surgical recovery as efficiently as possible. In terms of preparing for surgery, there are many papers now describing prehabilitation. This concept is multifactorial and it aims to prepare patients better for surgery by improving their physiological status. There's a separate chapter of prehab in the ERA Society book, as well as many excellent papers highlighting the benefits.
So I can see there's great examples here for patients' needs preoperatively. So if we think about the best way to do this, it seems obvious to give information in the pre-assessment clinic, but what other ways are useful methods of disseminating information to patients?
Well, traditionally, patients are listed for an operation, and then they have some time between the consultation, their pre-assessment appointment, and their admission for surgery. Patients will be given booklets, leaflets, and other documents and will be encouraged to read them prior to the operation. However, we know that patients do not always read or retain information given, particularly in stressful situations like having surgery. So we need to consider other materials that patient can access at home when they're slightly less anxious and can take time to read these things and learn about their recovery, what their role is, and how they can help us and help themselves recover better. Whatever method we use to educate patients, it must be consistent. No matter who is speaking to the patients, from the surgeon to the discharge coordinator, the message must be the same, particularly when talking about discharge from hospital. Patients will often know someone that's had surgery, or they'll be guided by one person, usually the surgeon, and base all of their expectations on that one message. So if the nurse tells a patient that they can go home on day 3 after surgery and they're expecting to go home day 7, there's a problem. The patients will now not trust that nurse and may think we're trying to kick them out of hospital too quickly. This consistency of care is where ERAS is the most effective. It promotes multidisciplinary communication so that all healthcare professionals know what the ERAS programme is and how best to implement the guidelines with patients. For instance, surgeons should inform the nurses about when it's not appropriate to follow all ERAS components, such as early eating and early removal of catheter.
That seems fair enough. So we can see what patients need and ways we need to educate them, but how robust is the evidence related to patient education, Angie?
So the evidence around prehab and pre-op education is evolving. There are interventions such as IV iron clinics, frailty clinics, surgery schools that have been implemented with good preliminary outcome data. However, the question will always be how to deliver the information, who should deliver it, when should it be delivered, and how do we evidence that that process has been successful? More research is definitely needed to establish what works best and how best to deliver it.
Okay, so Angie, you've explained what and how we need to tell patients, but why do we need to do this? What are the benefits of preoperative education to the patients that we see?
I guess the key benefit from my perspective is to reduce anxiety and to allow patients to be an active part of the recovery process. The ERAS programme is a continuum of care which patients are at the core of. They're key partners in everything that we do, and with their assistance and greater participation, particularly in the preoperative stage of their journey, we can increase their understanding of why ERAS is so important. This increases their compliance to ERAS, which in turn improves recovery, reduces hospital stay, and reduces complications after the op.
Okay, that's really great to know. Thank you, Angie. But what do patients think about preoperative education? Is education something they value?
Well, in my experience and in the available literature, patients prefer to know what's going on. And although asking patients to help themselves is a fairly new concept to some, most are willing to participate. I think traditionally recovering from surgery was very much a do as you're told process, as opposed to now, which should be more of a if you play a part in your own recovery, i.e. get up and move, you can influence how well you recover. This can be quite a change in practice, not just for the patients, but for the nurses too. Some patients still prefer to be guided by us, but personally, I don't think many patients would object to being given more information about how they can make a difference to their recovery. Besides, we should all be exercising more, we should all be eating less, and we should all be doing better things for ourselves. This is more about general public health information, just in a more targeted way.
Yes, that's very true, Angie. So it seems obvious now that patients need as well as appreciate being educated prior to their surgery. Finally, Angie, where might people be able to read more about preoperative education on the enhanced recovery pathway?
Well, as you know, Jenny, we have just written a chapter in the ERAS book. See the ERAS Society website for more information. But there are also many, many publications examining preoperative education. So I urge anyone watching to read about this topic a bit more and perhaps conduct some research and service improvement projects so we can better evidence this key component of enhanced recovery.
That was fabulous. Thank you very much, Angie.
Thank you. Good luck, everyone. Bye.
Thank you. Bye.